Conjunctivitis, commonly known as pink eye, is a prevalent eye ailment that affects millions of people globally. It is one of the most common and easily recognizable eye conditions. This condition arises from inflammation or infection of the conjunctiva, which is the transparent membrane covering the white part of the eye and the inner surface of the eyelids. Affecting individuals of all age groups, conjunctivitis can range from mild irritation to significant discomfort, causing redness, itching, and discharge. While it is often not a serious threat to vision, conjunctivitis is highly contagious. This makes early detection and management crucial to prevent widespread outbreaks. Understanding its various causes, symptoms, and treatment options is essential for healthcare professionals to provide effective care and advice. Recognizing the early signs and symptoms helps guide patients toward proper care, preventing complications and promoting faster recovery. The conjunctiva serves as a protective barrier for the eye. When this barrier is compromised, inflammation occurs, leading to the development of conjunctivitis. This educational resource aims to equip medical students and physicians with a thorough understanding of this common eye ailment, ensuring they are well prepared to diagnose and treat it effectively. Understanding the diverse causes of conjunctivitis is crucial for effective diagnosis and treatment. Conjunctivitis, commonly known as pink eye, can be caused by various factors, each requiring a different approach to management. Infectious conjunctivitis, bacterial and viral conjunctivitis are highly contagious, spreading through direct contact or contaminated objects. This type of conjunctivitis can quickly affect large groups, especially in close contact environments like schools or offices. Bacterial conjunctivitis often results from bacteria like Staphylococcus aureus and Streptococcus pneumoniae, which can cause significant discomfort and require antibiotic treatment, while viral conjunctivitis is commonly caused by adenoviruses. This type often accompanies other viral infections, such as the common cold, and usually resolves on its own. Allergic conjunctivitis, triggered by allergens such as pollen dust mites or pet dander, this form of conjunctivitis is not contagious but can be very bothersome, leading to itching, redness, and tearing. Managing allergic conjunctivitis often involves avoiding known allergens and using antihistamines. Irritant conjunctivitis, caused by exposure to irritants like smoke, chlorine, or chemicals. This type can be prevented by avoiding exposure to these irritants and using protective eyewear. Other causes. Less common causes include dry eye disease, blepharitis, or systemic diseases. These conditions often require a more comprehensive approach to treatment. Identifying the underlying cause is crucial for determining the appropriate treatment. A thorough examination by a healthcare professional can help pinpoint the exact cause. While some forms resolve independently, others might require specific treatments like antibiotics for bacterial conjunctivitis. Proper hygiene and prompt medical attention can help manage and prevent the spread of conjunctivitis. Recognizing the clinical presentation of conjunctivitis is essential for accurate diagnosis. Common symptoms. Redness, tearing, and discharge are typical signs. Bacterial conjunctivitis often presents with thick yellow or green discharge, while viral conjunctivitis might have watery or white discharge. Foreign body sensation inflammation can create a feeling of grittiness in the eye. Distinguishing symptoms. Itching is a hallmark of allergic conjunctivitis, often accompanied by sneezing or runny nose. Light sensitivity and swollen lymph nodes can occur in various forms of conjunctivitis. Assessing the patient's history and conducting a comprehensive eye examination helps differentiate between types of conjunctivitis. This enables healthcare providers to formulate an effective management plan. Early intervention is key to managing the condition effectively. Bacterial conjunctivitis is among the most prevalent forms of eye infections, primarily affecting children. It is highly contagious and can spread rapidly in environments like schools and daycare centers. It often results from direct contact with contaminated hands, surfaces, or objects. Children are particularly susceptible because they frequently touch their eyes without washing their hands. Common bacteria responsible for this condition include Staphylococcus aureus, Streptococcus pneumoniae, and Haemophilus influenzae. These bacteria can easily be transferred from one person to another. Patients with bacterial conjunctivitis often present with thick, sticky discharge, redness, and a gritty sensation in the eye. These symptoms can cause significant discomfort and irritation. Diagnosis is usually clinical based on symptoms and the presence of purulent discharge. A thorough examination by a healthcare professional is essential for accurate diagnosis. In some cases, a sample of the discharge can be taken for culture to identify the specific bacteria. This helps in tailoring the treatment to the exact cause of the infection. Topical antibiotics in the form of eye drops or ointments are the mainstay of treatment. These medications help to eliminate the bacteria and reduce symptoms. Completing the full course of antibiotics is crucial to ensure complete eradication of the infection. Skipping doses or stopping early can lead to recurrence. This prevents antibiotic resistance and ensures effective treatment. Adhering to the prescribed regimen is vital for a full recovery. Early diagnosis and treatment help alleviate symptoms and prevent complications. Timely medical intervention can lead to a quicker recovery and reduce the risk of spreading the infection to others. Viral conjunctivitis, often caused by adenoviruses, is highly contagious. Unlike bacterial conjunctivitis, it typically resolves on its own with supportive care. Transmission occurs through direct contact with infected eye secretions or respiratory droplets. Symptoms include watery or mucus discharge, redness, and swollen lymph nodes. Management focuses on alleviating symptoms with cold compresses, artificial tears, and avoiding contact lenses. Emphasizing proper hand hygiene and avoiding close contact with infected individuals are crucial steps in preventing the spread. Disinfecting contaminated surfaces also helps control the virus. Supportive care and preventive measures are key to managing viral conjunctivitis. Early intervention and hygiene practices can curb the spread effectively. Allergic conjunctivitis is triggered by an overactive immune response to allergens. Common triggers include pollen, dust mites, pet dander, and mold spores. Seasonal allergies often lead to a surge in allergic conjunctivitis cases. Symptoms include intense itching, watery discharge, and redness. Management involves avoiding triggers and using medications like antihistamine eye drops. Mast cell stabilizer eye drops can prevent the release of inflammatory mediators. In severe cases, short courses of topical corticosteroids might be necessary. Identifying and minimizing exposure to known allergens is crucial. This might involve using air purifiers and regularly cleaning the house. Effective management provides relief and prevents complications. Accurately diagnosing the type of conjunctivitis is crucial for appropriate treatment. Diagnosis involves a thorough medical history and physical examination. The clinician examines the eye for redness, swelling, and discharge. In some cases, further investigations like discharge culture and allergy testing might be necessary. Treatment depends on the underlying cause. Bacterial conjunctivitis requires antibiotics, while viral conjunctivitis focuses on supportive care. Allergic conjunctivitis is managed by avoiding triggers and using antihistamine eye drops. Irritant conjunctivitis requires removing the irritant and flushing the eye. Artificial tears can help soothe irritation. Self-treating conjunctivitis can be risky, so seeking prompt medical attention is recommended. Proper diagnosis and management ensure effective treatment and prevent complications. Preventing the spread of conjunctivitis relies on proper hygiene practices and infection control measures. Hand hygiene is paramount. Frequent hand washing with soap and water is essential. Avoid touching or rubbing the eyes to prevent transferring infectious agents. Not sharing personal items like towels, makeup, or contact lenses helps reduce the spread. Regularly cleaning and disinfecting frequently touched surfaces is crucial. Contact lens wearers should adhere to proper lens care practices. Educating patients about the different types of conjunctivitis and their treatment options is important. Patients with contagious forms should stay home until the infection resolves. Completing the full course of prescribed antibiotics ensures complete eradication of the infection. Follow-up appointments help monitor progress and ensure the infection has resolved. Conjunctivitis demands a comprehensive understanding of its causes, presentations, and management strategies. Each type presents unique challenges and requires tailored therapeutic interventions. This exploration equips healthcare providers with the knowledge to diagnose, treat, and educate patients effectively. Recognizing symptoms, understanding transmission routes, and implementing hygiene practices are crucial. Ongoing vigilance and proactive measures are essential. Integrating these insights into daily practice can reduce the burden of conjunctivitis. Promoting optimal eye health for all is the ultimate goal.